Hi everyone, it's Kate Lamont here from Thrive Aged Care Consultants, and I'm with Kath Kirby, Director at Thrive Aged Care. Hi.
Hey, how are you going?
Good. Now we're jumping on because we're excited to let you know that we're working with the Australian Physiotherapy Association, and we'll be running our positive approach to dementia care training for Australian physios. How exciting is that?
Ah, that's amazing. I think this group is going to get a lot out of the training. We've worked with lots of different health professionals from lots of different settings, lots of different backgrounds, and the feedback is pretty consistent about how different it is to traditional or the dementia training that we've received so far. Like we know you and I, Kate, have both done lots of dementia training, and this is a different approach, isn't it?
It is a different approach. And yeah, the reason why it's a different approach, well, firstly, it's dementia training that was developed by an OT with over 40 years experience working with people with brain change. Yeah, brain change and dementia. So that's Teepa Snow. Kath and I are both certified in teaching this approach. And the approach is based on recognizing and building capability around people's strengths and what abilities remain. Yeah. Now, the training is all about how you can really establish a positive connection and positive engagement for someone living with dementia so that you can build on their remaining skills.
I think that's really important because sometimes we're all great and we're all very experienced and passionate in the roles that we're in. But sometimes we can be very busy in the roles that we're in and we jump straight to a task and we have our agenda that we want to achieve and we have our goals that we want to achieve with our patient or our resident or our client. But we miss that really important step at the start, which is that building connection. And particularly for a person living with dementia, if we don't get that right from the start, then we are not going to maximize our interaction, are we?
No, and you're exactly right. So it doesn't matter what setting you work in or how much experience you've had. If you're working or supporting people living with dementia, this is for you. It's going to teach you what changes are happening in the brain for someone living with dementia. Yeah. In terms of vision, in terms of comprehension and language, in terms of their thinking, in terms of their movement. Yeah. And it's going to teach you how you adapt your approach so that you can really get off on the right foot and that you can establish a relationship with someone to make it a successful interaction for you and for the person living with dementia. And like Kath said, we all have our agenda and we're all busy. You know, we're all going in thinking we've got this assessment to complete. We've got this treatment to complete. You know, we've got to see 7 patients today. So I've got to do this now. But how can we stop and pause and just take a few minutes to set ourselves up for success for when we're working with people living with dementia?
Yeah, it's success for us and success for the person that we're working with as well. Because if you have that positive relationship from the start, then you're, the person living with dementia is going to have a better experience and we're going to get more out of it. So, our focus is always working to enable people's strengths and abilities as much as possible. And sometimes we do forget that. When we're caring for people with dementia, we are very focused on what they can't do and we're wanting to be focused on what they can do. And in order to get the best out of the person, it's all about the connection and relationship at the start.
Exactly. So what you'll take away from the day is you'll learn evidence-based skills and techniques that you can implement straight away in your practice, whether you're working in the community, in health, in aged care. You're going to be able to implement these straight away to really build that better connection, to communicate more successfully for people living with dementia, and to really help get people started with whatever task or assessment or treatment you're providing, to help you get started on what you're there to do, but in a more positive way. So please join us in Melbourne, and we're running this one day for physiotherapists all around a positive approach to dementia care, and we're really excited to see you there.
Yeah, can't wait.
Okay, see you guys.
See ya.